Basically, I joined medicine in the late 70s, and as a medical student, I became part of the students' movement in the All India Institute of Medical Sciences, and also we were associated with various other social movements, like some workers' movements and other social movements. And we started seeing that health is something that is much broader than medicine. And even though I did my medical education from the All India Institute of Medical Sciences, which is like a highly specialized center for medical technology, but still I felt that public health gives a much broader view of how actually diseases are caused, how their disease conditions are perpetuated in larger society, and how they need to be controlled and tackled. And these disease palaces, like big hospitals, we only see the end result of very long processes and very widespread processes which are going on in society. So I felt that as a public health professional, I would be able to do more to actually tackle the causes of ill health and to prevent disease and to promote health than as an individual clinician. So that's why I decided to go for public health. For the last 20 years, I'm based in Maharashtra, and we are working as a part of a team called the Sathi team. We have been doing work on, you can say, 3 or 4 broad areas. One is the entire area of systematically developing accountability of public health services. And this has been done through various activities in collaboration with grassroots groups, mass organizations, NGOs, promoting the whole process of health rights. And in this, the most sort of recent and large-scale process that we have been involved in is something called community-based monitoring and planning of health services, which we are doing in nearly 1,000 villages across 14 districts of Maharashtra now for nearly 8 years in collaboration with the National Health Mission. So, and this has led to a remarkable range of improvements, and at the same time a lot of mobilization on health rights. And we have done something like 500 public hearings as part of this process. So that is one major front. The other front is basically regulation of the private medical sector and patients' rights in private hospitals. Because in our country, 70 to 80% people go to private health facilities, and there's almost no regulation, very little accountability, and very few groups are working on this. So actually this is an important area of work where we're working on one hand with community groups to raise awareness about patients' rights, and on the other hand with doctors in the private sector who are uncomfortable with what is happening right now, irrational care, unnecessary procedures, malpractices, overcharging, and building a constituency of rational doctors also. This is the second front. The third is working on nutrition and community nutrition, which, as you know, is a key social determinant of health, and where we have been doing something called community-based monitoring and action to improve child nutrition in Maharashtra. Where again, similar to community monitoring of health services, here we are looking at the Anganwadis, the ICDS services, and also household practices for child nutrition, how to strengthen those. And finally, we do a range of research, action research, including our latest activity has been developing a document on universal health care in Maharashtra, how to develop a system for universal health care in Maharashtra. See, actually, I would like to make a qualification that what is usually called the SDH approach often tends to be somewhat limited to just a listing of the factors like water supply, sanitation, nutrition, food security, environment, etc., etc. And of course, that is the first level. But I would say that we should move beyond that and look at social determination of health, which is beyond just social determinants. When we talk about social determinants, it appears as if all of these are like some random just list of factors. All of these and many more there's a cause behind the causes. So water supply, sanitation, nutrition, food security, environment, etc. These are the cause for ill health. But there is a cause that is behind these causes. So if entire communities, entire populations, entire classes, entire groups of people are not getting any of these in an adequate manner, there must be some deeper cause. So if we only look at it as a problem of delivering some water supply, ensuring some sanitation, that will be inadequate. It is necessary, but it won't be adequate. Social determination of health looks at social structures, political structures, economic structures, and the way in which society is actually today built, and how social injustices are taking place, and how those need to be addressed and social structures need to be changed and transformed. That is actually the more long-term and more basic approach to social determination of health, which is the way that I would like to put it. In my view, in the Indian context, work on SDH actually in practice has been very weak. In the public health system, there is some lip service that is paid to it. If you look at any document, you will find some mention like in the NHM or even in the health policy documents. But if you look at two things, what kind of human power is the public health system devoting to ensuring social determinants of health? And you will have to look at with a microscope to find any official or any staff that is dedicated to social determinants of health. So you can say, okay, maybe some of the things that an MPW does are relating to drinking water quality and maybe a few other things, but actually we don't have a dedicated cadre who is addressing social determinants of health in the public health system. And similarly, what proportion of the health budget is, or any budget is related to social determinants of health? Almost nil. There is a clear way in which this can be done, and that is through having public health officers, through having essential public health functions being carried out by the public health system, where the public health system should monitor what is happening to water supply, what is happening to nutrition in different communities, in different areas, what is the state of environment, and then feeding this information to the relevant departments in a kind of empowered accountability platform. If that is done, then SDH can be addressed. If there is no human power, no budget, no structure, and it's just a declaration, in a vague declaration in policy documents, not much is going to happen. And frankly speaking, until now in our country, actual action on the ground has been very limited. Actually, there are probably dozens and dozens of such examples, maybe even a few hundred such examples. And we have documented in a book called Stories of Change, where how these changes have been taking place. But just to give one example, from Amravati district in Maharashtra, where a federation has been formed of the different community monitoring committees. And these federations are the different, from the village level to the PHC level to the block level, all the different kinds of members, Panchayat Raj institution, representatives, civil society organizations, active community members, journalists, all of them are there in this federation. And they have, after the federation was formed, they said that when we are going to work on health issues, we won't just confine ourselves to healthcare. We have to look at education, we have to look at rationing and PDS, we should start looking at employment, and of course we should look at nutrition. And this federation, they found 4 subcommittees to work on each of these 4 areas, and they have done some very interesting work on to address each of these determinants. So for example, they found that children of migrant workers, when the family migrates out, the children also migrate out, and their education is totally interrupted, it's disrupted. So then they went and talked to the contractor who takes the families, and they also talked to the officials, and they said, these children, we have to ensure that their education is not disrupted. They should stay in the taluka. So they set up a hostel for these children of migrant workers, so they can stay in the block and their education was not interrupted. So first of all, look beyond the obvious. Don't just confine yourself to what is written in the textbook or what is told that this is the list of social determinants of health. Think beyond. Think deeper. Why is all this like this? Why is it not different? Why are so many people in poverty today and a few people are in a better off situation? Is there some deeper structure that is involved? Does that also need to be thought about and changed? Or are we just going to limit ourselves to making a list of the problems? So first is think deeper. Secondly, people are the basis for all change in society. If people are not involved, no major change can take place in any country in the world. And if people are centrally involved, any change can take place. So it's ordinary people, their empowerment, their organization, their mobilization, which is at the center. So even as a researcher, we should look at studying these processes, documenting these changes, documenting rights-based mobilization, social mobilization of various kinds, and as an important aspect of research. So research is not just doing, multiple regression studies on certain kinds of, data, but also looking at qualitative processes which take place in communities. And some, as Einstein has said, that not all that counts can be counted, so we have to also look at qualitative processes and community processes as being very important in ensuring social determinants of health.